And exactly at 11, you can go ahead and start. Let's see. I'm going to.
I have 10:59. Just let me know, Maria, when we're ready to rock and roll.
You're ready.
Okay. Well, good morning, everyone. I'm Stu Bambino with the Santa Rosa Chamber of Commerce, and I want to thank Valley Care, Stanford Valley Care, for hosting this very informative presentation today. I don't know if anybody's been in a situation where you're trying to decide, do I need to go to urgent care or do I need to go to the emergency room? I've been there, and I think a lot of other people have been there. So thank you for joining us today and being part of our presentation. I want to thank a few people here before we get started this morning. Our chamber partners, who we have a great working relationship with, I want to thank them so much. The Livermore Chamber, the Pleasanton Chamber, the Dublin Chamber, and the Danville Area Chamber of Commerce. Thank you so much. And I also just want to make a little note here. One of our chamber members, president, is retiring, Steve Van Dorn, and I just want to thank Steve for all of his support and friendship over the years. And thanks, Steve. We'll miss you. Okay, with that, let's get started. I know you're all busy today, so let's get started with our presentation. I'm going to introduce the doctor today, Dr. Edward Kahn. And Edward Kahn, MD, is the managing partner of the Pleasanton Emergency Medical Group, which is responsible for staffing the physicians and mid-level providers in the emergency department at Stanford Healthcare Valley Care in Pleasanton, as well as Stanford Healthcare Valley Care urgent care locations in Dublin and Livermore. The doctor has practiced with Valley Care in the emergency department and urgent care for 17 years as a Stanford adjunct clinical assistant professor with the Department of Medicine, Primary Care and Population Health. Doctor, thank you so much for being here today. We really appreciate your time. I know your time is extremely valuable, but I'm sure we're going to get a lot of great information. So thank you, and it's all yours.
Thank you. Hello, everyone. I'm Edward Kahn. I'm the managing physician for Pleasanton Emergency Medical Group. I apologize about the background. My dog may come charging in, but I'm sorry if that happens. I'm happy to talk to give this presentation about emergency department, urgent care. When to go to each location. Now, I wonder if is Shelby, are you going to share the slideshow or am I going to share it?
I'm on mute. If you want me to share it, I can find it. But if you have it ready and you want to share, that's great too.
Okay, hang on one second, guys. I'm sorry about this. Let me see if I can get it real quick. But let me just, or actually, if you can find Shelby, that'd be awesome. Because I don't multitask that well. Yes. So my name is Dr. Kahn. I'm an emergency physician, and I've been practicing here with Stanford Valley Care for about 17 years. I've worked in the emergency department, and I do work in the urgent care as well. We have an urgent care in Dublin as well as in Livermore. I don't know if any of you guys have ever been to these locations, but I have included some maps just so you guys can see them if you've never seen them or been there. Let me see actually if I let me see if Shelby.
Sorry, I'm looking for it. I apologize.
No problem. I'm sorry. Apologize. Can you guys all hear me okay? Yeah. Okay.
Yeah, we hear you great.
Very good. Very good. Thanks. I'm giving 1 second. Maybe I can pull it up real fast. My apologies.
Okay.
My apologies. You got it?
I did find it. So let me just share the appropriate screen here.
Thank you so much.
No problem. Okay, and Steve, I'm sorry, Stu, can you give me sharing capabilities?
I did.
Okay. Okay, great.
Great, thanks. All right, you can go ahead and advance the next slide. Thank you. So yes, so this is our emergency department. Hopefully you have never had the opportunity to be here. It's where the main hospital is in Pleasanton at 5555 West Las Positas Boulevard. It's right off of West Las Positas and Santa Rita. So our emergency department is, you know, I've worked in an emergency department for 17 years. Recently, we've had the merger with Stanford, but before it was just Valley Care, and now we're Stanford Valley Care. There are a lot of things that have changed, have actually been changed for the positive. A couple of things: we are a primary stroke center, so we're a stroke receiving center. So if somebody is having symptoms of a stroke or having a stroke, they will preferentially be brought to our facility. We're also a designated STEMI receiving center. STEMI receiving center is a fancy name for heart attack or ST elevation myocardial infarction. Essentially, if somebody's having a heart attack, then they will also be preferentially taken to our facility as well. And we do have a whole STEMI program, and we do immediate percutaneous coronary intervention, or they'll go in with a stent and open up your blocked artery, and go in with an angiogram, open up the blocked artery, and break up the clots. Whereas locations that are not STEMI receiving centers, they don't have that capacity to do that interventional procedure to open up your heart and to allow the blood to flow better. We are all of our physicians are American Board of Emergency Medicine certified physicians, and so we've all been trained in emergency medicine residencies. This is what we do on a daily basis. Previously, emergency departments were not necessarily staffed with emergency trained physicians, but this is what we do on a daily basis. And we've been trained. We've done a residency in emergency medicine, and we pretty much deal with emergency medicine on a day in and day out basis, and have been trained to do so. We're open 24/7. We do not close, and we're open at all times. And this is a little map. Yeah. We have two urgent care locations. This is Valley Care Livermore Urgent Care. This is Valley Care Livermore Urgent Care, as well as the Valley Care Dublin Urgent Care. The Valley Care Livermore Urgent Care is located at 1133 East Stanley Boulevard, which is at the location of the old Valley Memorial Hospital. Both of our urgent cares, the Valley Care Livermore Urgent Care as well as the Dublin Urgent Care, are open from 10 a.m. until 8 p.m. walk-in. Both locations will take patients up until the end, in terms of some people roll in at 7:55 and we'll still see you. It turns out that the slightly more busy times are in the morning in Livermore. For some reason, in the morning at 10 a.m. at Livermore, there tends to be a number of patients who are kind of wanting to see it at that hour, around 10 a.m. hour. And then in the Dublin Urgent Care, it tends to be more of a group of people who are showing up maybe a little later in the evening, between 6 and 8. If you're trying to think about, hey, when, if you can get to either of them, and it happens to be 6 p.m., sometimes going to Livermore is a little bit easier in terms of there's not going to be a lot of people waiting. Our urgent cares in general tend to be, this is also a picture of our Livermore Urgent Care. The Livermore Urgent Care is in 4000 Dublin Boulevard, Suite 150, which is on the corner of Dublin Boulevard and Tassajara Road. It's that really big Palo Alto Medical Foundation building. Also, the south side of it is our urgent care, where the picture is there. Also open from 10 until 8. Our urgent care is actually, one great thing about our urgent cares is that we're walk-in at all times, in terms of you do not need to make an appointment. And although we do make appointments, typically when you call in to make an appointment, most of the time they'll tell you, hey, just come on in. It's a very short wait. And we've been, one thing it's great is that we have been very successful in upon door to provider time is quite fast. Like usually it's within 10 minutes. So it's not something that typically is a excessive wait, although there's no guarantees. When COVID hit, things have stretched out longer, but it is not typically a terrible situation where you're stuck for a very long time waiting to be seen in either location. So I think that it's open all the time. It's walk-in 10 to 8, and it's not a huge, it's typically not a huge wait. And I think that I think we're practicing excellent medicine there. So yeah, okay. We go on to the next slide. Thank you. So this is a question oftentimes that I'm asked, and it's something that is an interesting question, is that, when should you go to the emergency department for when should you go to the urgent care? And I kind of listed out a number of common things which should be evaluated in the emergency department, and a number of things that should be evaluated in the urgent care. With this being said, some people will show up at the urgent care with a situation which actually can be quite serious, in which case we'll oftentimes either transfer you or recommend you go to the emergency department to get evaluated for these issues. For example, emergency departments, chest pain, heart attack, shortness of breath should be in the ER to get checked out for that. Stroke as well should be done through the emergency department. Sepsis, which is, when you have a very severe infection, it's getting into your bloodstream. And these will be sepsis. How do you know you have sepsis? Usually it's fever, other signs of infection. If I were having sepsis, I would typically be having high fevers, chills. I might look really bad. I might be pale and sweaty. My blood pressure will be low. I might be confused, ordinarily, if you talk to me and I'd be really lethargic, not able to speak with you, these kind of things. Abdominal pain, severe nausea, vomiting typically also should be evaluated in the emergency department. Seizures, syncope, which is fancy name for passing out. If somebody straight up passes out, they probably should be checked out in the emergency department. Fractures, traumas, burns should be typically cared for in the emergency department. Overdoses, mental crisis, if somebody's been depressed and maybe talking about maybe hurting themselves, they should be in the emergency department to be checked out for that. One thing actually I did want to include, so in terms of each urgent care is a little different, and each urgent care has like a slightly different flavor of what they do and what they don't do. Our urgent care does have access to also all kinds of x-rays. So if you have something that is injured, we can x-ray it immediately, as well as getting a specialist radiology reading immediately. So if my son twists his ankle's really hurting, I might recommend that he go to the urgent care to get an x-ray. One great thing with our alliance with Stanford is that the x-rays are now, if my son who's 9 twists his ankle, the x-ray may look a little weird, and it may be a thing where it's hard to say for sure if it's broken or not. But we, in both the emergency department and the urgent care, a pediatric radiologist will be reviewing it and giving us a report on that in a reasonably timely fashion. It's a little slower than I would prefer, but these pediatric radiology specialists, they're really good, but they're not always the fastest. Anyway, sorry. So that's a big plus. They do have x-rays. They also are able to check for other common things like tests for COVID, tests for strep throat, tests for urinary tract infection, pregnancy tests, and also at times in Livermore, we have capacity to do ultrasounds during certain hours of the day, to do ultrasounds in the urgent care. The other more advanced kind of testing is typically, also our urgent care has capacity to do blood tests as well. Our emergency department has the capacity to do everything else, such as CAT scans, MRI, MRI imaging, and other, more advanced things, such as having specialists come down, like orthopedic specialists come down, or having cardiology specialists or gastroenterology specialists come and evaluate you. These kind of things are all done through the emergency department. So in our urgent care, other things, so urgent care type issues would be, for example, respiratory infections. If you have like a cough, sore throat, you think maybe it's COVID and you need to get tested, or talk to a doctor or a physician assistant or nurse practitioner about, hey, look, how serious is this? Do I need to get treated if I have COVID? Urgent care is absolutely takes care of that. Fever, flu, sore throat, for sure is absolutely treated at the urgent care and evaluated well. Also rashes, sprains and strains, cuts, abrasions. At our urgent care, we can pretty much stitch most everything that's injured. Although if it's something that's really bad, then it needs to be in the emergency department. But like if my son fell down, got a cut on his leg, he can get stitched up over the urgent care. Animal or insect bites and abscesses. If my son had a boil on his leg, that's some like pus leaking out. He might need to go to the urgent care to get it incised and drained so they can cut it open and get the pus out of there. Insect bites, animal bites, urgent care actually has a capacity to treat all of these. And then thanks. We can go to the next one.
Dr. Khan, just one point of clarification. I know you were talking about imaging in the urgent care
Yes.
versus the emergency department. And I think a point of clarification that might be helpful is an understanding of who reads those results, and if that is the same group, whether you're in the urgent care or in the emergency room, that is reading those images.
Absolutely. Yes. So thanks for that question. Absolutely. The X-rays. So in the urgent care, most imaging is done X-rays. In the emergency department, we're doing CAT scans and MRIs, or also X-rays as well. In the urgent care, or in all locations, we're all connected to the same Stanford Radiology Group. And the Stanford Radiology Group also has subsets of radiologists who do different things. So commonly in the urgent care, if my son twisted his ankle, the X-ray would be done, and that would be sent to a pediatric radiologist who is only reading children's X-rays, and they will provide a report and interpretation about the X-ray. And if you're in the emergency department and if I'm worried that you're having a stroke and we did a CAT scan of your head, that will be sent to essentially the neuroradiologist over at Stanford. So there are a lot of kind of especially radiology things which happen on the backside to make sure that the imaging is interpreted in the absolutely correct fashion. In our urgent care, pretty much there's only a few hours. So pretty much as a rule in our urgent care, all of the images are interpreted by radiologists and some specialty radiologists as needed. There is a funny time period between, I believe it's 5 p.m. and 8 p.m. on the weekend when the pediatric radiologists have gone home and they're not reading the pediatric x-rays. So actually in those situations, the pediatric x-ray will give a preliminary interpretation by the doctor at the urgent care, or also sometimes the doctor in the emergency department will also be reviewing it as well, depending on how complex it is or how strange it looks. And that's also the case also in the emergency department, the overnight. I don't necessarily expect any of you guys to remember any of this, but like if you come in at 3 a.m. and I get an x-ray of your ankle, the radiologists need their beauty rest so they can continue to read appropriately. And so they're not up in the middle of the night and they read it in the daytime. So whereas, I don't need my beauty rest, but anyway.
Doctor,
Thank
we
you
did
so
have one
much.
question that came in the chat. Maybe it's a little off topic, but what's the difference between an emergency room and a trauma center?
Oh, absolutely. So emergency departments are as you would expect, where basically it's the emergency department affiliated with a hospital. Each emergency department can have different designations, and so Valley Care is designated as a stroke center and acute MI center, but we're not currently designated as a trauma center. Although in our long-term plan, that is something we're absolutely working towards making happen. And that kind of depends a little bit on the county, but on Alameda County. But and so we're not designated as a trauma center. What that means is from a basic standpoint, so supposing I was walking down the street in Dublin and I got shot with a gun or something, and it wasn't something simple like I got shot in my finger, maybe I got shot in the stomach, then that would be criteria where somebody called 911, and that would be 911 has their certain criteria and different pathway they go through, and they say, okay, this patient needs to go to a trauma center, where they have a trauma surgeon in the hospital ready to take me to the operating room immediately upon arrival if I've got shot in the stomach, just for example's sake. And in that situation, if I was picked up in Dublin, I would then most likely be transported to the closest center, which is considered to be trauma center, which I think at this point is considered to be Eden Medical Center from Dublin. And so that is the main difference. The other difference is that that's kind of the main difference, is that you have 24/7 trauma surgeon coverage, and also, in addition, there may be some specialties at that hospital, which may not necessarily be present at a non-trauma hospital. For example, if I've, in my example, I've gotten shot in my stomach, you might need a specialty surgeon, like a vascular surgeon, to help who works on, like, sewing up arteries and occluding, like fixing abdominal aortic aneurysms, to be available to as a subspecialty to come in for that. Also having something called an interventional radiologist, who is able to, if there's bleeding coming from an artery that you can't get to by surgery, the interventional radiologist will sometimes go in there and zap it with like a coil and stop the bleeding that way. So there's different subspecialties which are required to be a trauma center. That actually, ideally, I don't know, I can't make any guarantees, but this is something that absolutely we're working on. And I'm hoping that if we have this again 5 years from now, I'm hoping to be able to say, hey, yeah, we're a trauma center as well. And so that, I think, would also provide, granted, most people are not getting shot in Dublin, but,
Car accidents?
Yeah, absolutely.
Yeah.
Car accidents, these kind of things absolutely happen for sure.
Yeah, and just to expand on that, Dr. Khan, I do know that, as you indicated, we are working diligently with the county on addressing the feasibility of a trauma center here at Valley Care. And there have been, and the chambers have been great supporters of ours, working to provide letters of support for that to the Board of Supervisors. So the county is engaged in a study right now on feasibility of an additional trauma center, and we very much want to pursue that. So thanks for mentioning that.
Yeah, absolutely. I'm super excited about that. I think that it'll be great for the community, and I think that it's kind of a funny thing where where in my residency, I've been really trained to do a lot of trauma. And then now I'm in a location where I don't do that much trauma, which, is kind of like a little piece of emergency medicine, which I'm not getting to do, and I think that trauma would be great. I would love to do it. And I think that all of our docs would love to do that.
Doctor, one more question came in the chat. What's the most common thing you see in emergency rooms? Heart attacks or strokes, or is there one?
We do see a lot of people who have, things like, chest pain, abdominal pain, maybe they're concerned they're having a heart attack, or they're concerned that maybe there's something going on in the stomach, like a appendix, that stuff is pretty common. We, back in January of this year, pretty much everyone in the whole county got COVID. So we saw a ton of COVID, where it was crazy. I would have somebody who had like a broken ankle, and they twist their ankle is broken, and then the orthopedic surgeon said, hey, yeah, this needs surgery. And then before they go to surgery, then they COVID test, and oh, by the way, they have COVID. Or somebody would come in with abdominal pain and they have appendicitis, they need to go to surgery. Oh, by the way, you have COVID. So that was the most popular thing in the beginning part of this year, was having COVID. It's kind of big, huge. It was a huge thing, you know.
And that's just prompted one other question: is how common is it now? Is it starting to level off, or how are we doing?
COVID was really good, basically from maybe February until March. So we had a good like 1 or 2 months in there. There's a new variant that's coming out, which my belief is that the new variant, my belief is that probably 95% of all Americans had COVID or have become immune to COVID by one way or the other, meaning that maybe they got vaccinated and the vaccines really took with them, or maybe they're vaccinated plus they got exposed to COVID and maybe they didn't even really get sick with it. So probably 95% of everyone in the United States has been exposed to COVID. So when the new COVID comes out and it's starting to hit everyone, it's now by definition going to be a different strain, which you can get it again. So I think that we're going to have maybe in the next, I mean, we're headed towards summer. So it's, going to be, it's strange that COVID is breaking out now towards the warmer parts, but I'm not sure if the next like 2 months, maybe 3 months, we're going to start seeing some more COVID, or whether it's going to wait until winter and then we'll see that same COVID then. But it's probably going to be the same kind of thing where this new variant is more contagious than the Omicron variant. So it's going to be another thing where 95% of all Americans get it again. So the goal is that, and this does go through my head every time I see somebody who has COVID. People have a lot of feelings about, COVID vaccination, COVID treatment, and these kind of things. I do, from my standpoint, for me and my family and my patients, I really do appreciate it if people have gotten their vaccination, if they don't have some major issue where they cannot get their vaccination, because then I know for sure that they're going to be okay in the end. Whereas people who have not been vaccinated, I worry about them a lot, kind of worry about them when they're in the department. I worry about them at home. It's kind of a thing where there are some new treatments out there, the treatments such as like Paxlovid, Paxlovid, for example, or the monoclonal antibodies, which are effective against Omicron. But those, because they're in quite shortage, it's especially at the beginning of the year, it was very, very difficult to get it. You had to kind of meet all sorts of crazy criteria to be able to get the medicines, because we're in a chronic state of almost being out of the medicine. But hopefully that Pfizer will create more of this Paxlovid and it'll be more available. But
well, I know just personally, I did get my booster shot at your urgent care in Livermore, and from the time I got there to the time I left was probably about 3 minutes. So
that's really good. That's great. They probably should have held you longer to watch you, but that's awesome.
That was my third one, I think. So.
Oh, okay, there you go. Yeah.
But thank you. I don't see any other questions here in the chat. Shelby, did you have any other questions that you wanted to ask, or anyone else?
Sorry, no additional questions at the moment, but Dr. Khan does have an additional slide, so we can move on to that.
Oh, good.
Oh, yeah. So I want to speak real fast about, why Stanford Valley Care Healthcare? Why us when there are other options out there? There's San Juan Regional, there's John Muir, there's Washington Hospital. Why us? We provide, absolutely, we do provide world-class heart attack stroke care. I'm not sure why, but our stroke mortality is excellent. It's, compared to hospital size, our stroke mortality is just really kind of extremely excellent for some reason. I can't say for sure why, but our heart attack care is amazing as well. Our cardiologists are super on top of things. And if I had a heart attack, I absolutely would be, headed straight over to Valley Care. Access to Stanford Medicine has specialists. I spoke with this a little bit earlier about having the specialists, especially pediatric radiologists around. And I've actually listed a whole bunch of things on the right side where we have really recently being aligned with Stanford has been very good in terms of giving us access to a lot of great specialists that you wouldn't have elsewhere. For example, so hepatology, we have an amazing hepatologist, Dr. Dharan Maraju, who is really providing great care to liver patients, patients with cirrhosis, and who are having liver issues, maybe even headed towards liver transplant. We're really kind of a magnet center for that. People can actually come from all over to kind of see us regarding for hepatologists. For cardiothoracic and vascular surgery specialists, the surgeons who will be doing bypass surgeries or abdominal aortic aneurysm surgeries or declotting of clogged arteries. We have a great group of specialists who, from surgical specialists, do this. We also have a lot of great advanced gastroenterology care, which is including procedures such as called ERCP. It's like a special endoscopy where they shoot dye into your bile duct, and also endoscopic ultrasound, which is a crazy fascinating thing they'll do is they'll go in with an endoscope into your stomach and then use an ultrasound to get great, beautiful pictures of your pancreas to make sure you don't have a pancreatic mass. We also have a new thing which started within the last 6 months is our telepsych program, where if patients are coming in and they're in a mental crisis and they don't really have anyone to talk to or nowhere to go, which is actually a very, very common situation nowadays, because you can't really access mental health nowadays. It's hard to access mental health in general, but it's really hard if you're in a crisis. Like, where do you go to? Who do you go to? We have telepsychiatrists who actually are really excellent, and so they'll actually will come in on a camera and talk to you on camera. So they get to stay home in their pajamas, I guess. But it's really good because I think psychiatry, you can talk to people over a phone and computer and really get a good feeling. So that's actually a real big plus that we actually have access to in our emergency department. Teleneurology, which is when we have the stroke patients coming in, there are neurologists. If they're not there in the hospital, which they usually are until like 5 p.m. or so, the neurologist will come on the screen, and oftentimes it's a teleneurologist who's actually working currently at Stanford. Radiology and pathology subspecialists, and then also spine, orthopedics, and sports medicine. Stanford is really working to develop a lot of really good spine care, which was not the case actually when it started 17 years ago. We had spine doctors, but Stanford has done a lot to, bring in some really excellent specialists, and pretty much, we're actually all from the community. We all really care about the community. I live in Danville, and I grew up I went to San Ramon Valley High School, so I am really dedicated to providing top level emergency and urgent care in this area, and I think that all of us all of our doctors and nurse practitioners and physician assistants are all local, and we all really care about the location. And so we really, it's not like, this is not a job for us. This is actually our community. And last thing is we're open all the time. We never close, and our urgent cares are open all the time to walk-ins. And so we don't care about your insurance. We don't care about your ability to pay. We'll take care of you. We'll provide excellent care for you. So.
Yes, doctor, that was a question that did come up here. It says, if I have Sutter Health with the Palo Alto Medical Group, can I still use the Stanford Urgent Care?
Yes, absolutely. Yep, absolutely. There's no restriction, and I believe that I believe that the Sutter Health in Dublin does not have an urgent care. I think they have a pediatric urgent care open during certain hours, but I don't think they have an urgent care. So oftentimes, if you can't get an appointment, but you have something which is you need to get checked out, for sure, we'll take care of it. And we're open to everyone, really. And we also actually do have access to our computer system is called Epic, which is the main computer system that Sutter and Kaiser, we're all on Epic. And so we have access to your records as well. And also, by conversely, when the visit is completed and we complete our record, our chart, that also is accessible by your Sutter doctor or your Kaiser doctor. You can actually go into the computer, click on this thing called Care Everywhere, and you'll see it all there. So it's computers are all talking together, which is a weird thing, but it's really cool. So.
And to continue on with that question, same thing with the emergency room, doctor?
Correct. Yes. Yes. The emergency room. Absolutely. Yes. If you are going to Sutter, if you are if I went to go see my doctor in Sutter and I was like, my chest is hurting really bad, they'll say, go to the ER, go to Valley Care right now. That's what they'll tell you. And absolutely, we'll take care of you for sure. Same thing also too, if you go to the Kaiser there's a Dublin Kaiser urgent care. And then if you walk into there and you're like, my chest is really hurting, I don't feel well, they'll say, get in the ambulance, you're going to Valley Care right now. And so they don't we provide the emergency care for all patients. There's no discrimination on your insurance or anything like that. And all the different locations say, refer to us. There's no other emergency department there's no other emergency department in this kind of local area that does what we do. So.
Okay, well, absolutely excellent. Thank you so much.
Absolutely. This is great to talk to you guys. And, I'm happy to spread out the word of our work here. So.
Well, great job. We're so fortunate to have Stanford Healthcare, Valley Care right here in our backyard. Like I said, our family have used it for multiple occasions. And so great job. Thank you. I don't see any other questions in the chat or the question and answers section, but we have recorded this. It's live on our YouTube. I just want to thank everybody for being here today. Doctor, thank you so much. Our partnering chambers, thank you. And both Shelby and Denise, thank you so much for presenting this great information. So with that said, everyone have a great day.